Dr. Perry Wilson, an associate professor of medicine at Yale, joins me now. And doctor, when I think of certain vaccines that are required, let's say from schools, considering this is a hospital, should it be mandatory for the employees here? Good morning.
Good morning. Yeah, I mean, it's nothing new to require hospital employees to be vaccinated. My hospital requires us all to have flu vaccines and hepatitis vaccines, in part to protect ourselves, of course, but also to protect our patients. Let's not forget that our primary duty is to protect our patients, and many of our patients might not be able to get the vaccine or mount an appropriate immune response to the vaccine for various reasons, including, being immunosuppressed or having an organ transplant. Now, they make an argument that these vaccines were only approved under an emergency use authorization, and I'm not a lawyer. I'm not going to speak to how valid that is, but that argument's not going to hold up for long. As you point out, both Pfizer and Moderna are filing for full FDA clearance, and all of us expect that they will get that full FDA approval. So I think there's a long history here of healthcare systems trying to protect their patients, and we might see vaccine mandates become more frequent across various hospitals.
And doctor, a new study suggests that we should still be wearing masks and social distancing right now despite vaccinations. And considering the mask mandates that are being lessened in many states, it depends on where you live. But going into a store yesterday, no one really having one on, I felt safe, but I still wore mine, meaning I think I'm going to have to be weaned off this. What does science show? Is it time to get rid of the masks?
Yeah, it was an interesting study, although it really just showed what makes a lot of sense, which is that while we are getting as many people vaccinated as possible, you'll have more infections if you take away those other mechanisms to reduce viral spread. Now, the study did not say, it's really important to know, the study did not say that people who are vaccinated should keep on their masks. It just said it was looking at kind of a simulated population in general. And as that population gets vaccinated, they say, oh, sure enough, if you keep masks on while you're getting people vaccinated, you'll have less overall infections. This is not a great surprise. Importantly, it shows that as you get those people vaccinated, the most important thing is that number, how many people you can get vaccinated, what percentage of the population. That's what we need to focus on. And there is good data to suggest that allowing now people who are vaccinated to remove masks inside has actually boosted vaccination. It's moved people off the fence a little bit. So that should be our primary goal. And for people who are vaccinated, that's not what this study was looking at. It was looking at rules for the entire population, not specifically for people who are already vaccinated.
And when you see the numbers for those who have gotten the vaccine, both doses, how are you feeling about that in terms of the population as a whole and America in terms of if we were able to get enough people to want to take the vaccine?
Yeah, I think we're getting there. We really want to push to get around 70% of the entire population, I'm including children here, about 70% vaccinated, potentially a little bit higher in adults, because that ends the pandemic. And yes, vaccination has fallen off a little bit as people are on the fence, but let's remember that these people really are on the fence. A large number of unvaccinated people now aren't diehard, I'm never going to get vaccinated. They're just adopting a wait and see attitude. And the more people get vaccinated, the more we're going to bring them in. We're seeing more and more how safe these vaccines are. So I'm hopeful. I think we'll get there, but let's keep pushing.
Sometimes it is really about convenience, and just we're seeing more sites popping up where you can get it. Dr. Perry Wilson, thank you.
Thank you.